We're very excited to have you here, Larry, because you have a lot to share and hopefully open up a lot of minds about what is actually possible for your own healing or for those that you love. This is kind of beyond the ordinary. Larry does not do traditional work. He is not a doctor, but he's been in the world of healing for quite some time now, decades actually, I believe. Is that correct?
Yes, many years.
And I've witnessed a lot of the people that he's worked with and how they have healed from all kinds of disorders. Larry doesn't call himself a healer. He describes himself more as what, an intuitive?
Intuitive is the best word for lack of words.
Yeah, okay. And the way I understand it is that you have been told and has been used by Solomon, who is a gentleman many people know from the last decade, as his human X-ray machine, because you can see things that most people can't see.
Apparently so. I believe everyone has the ability to see these things. They don't, or they don't tune in. But apparently I can tune in pretty well most of the time to the inside of the body and see issues. As we work with someone, we go deeper into the body, into the emotional issues, into the format even of the past life and so forth, as to the influence. And these influences and these issues come out. They come to me sometimes in thought form words, just in a sentence. Sometimes it's a feeling. Sometimes it's an area to go to that we need to correct and make right.
And you use the word we. So is there a contingent that you work with on some level?
That's a good question. I don't consider myself working alone. I would love to have someone to blame it on. And I have these wonderful people around me spiritually. I think one of them is my father, who has passed. He was a healer in his own right. He was a pharmacist. But he and others are around me, working with me. Some people might call them guides. Other people might call it spirit channeling, whatever. Regardless, I feel like I'm not alone. I speak in the collective. As a result, I say we see this, or we think this, and so forth, as opposed to just me, Larry.
Okay, and that's not a new phenomenon. I believe there are many people that work as a collective. Once we move out of this framework that we've established for ourselves here on planet Earth, I think it's much more common that many minds come together as one. We may call them a name, but my experience has been it's often more than one working together, and what power there is in that.
Yes.
So if one of our viewers came to you with an issue, does it matter what it is? Do you take an intake and find out all about them, or do you just agree once they've signed up to go in and take a look and see for yourself?
We like to hear about them. We like to hear all the medical examinations, all the other healers they've been to. We like to hear all the aspects of their issue. They may have one main issue, other smaller issues which contribute, but it's best to get all the information up front at first if we can. I worked with others where it's been point blank and there's been no information. And sometimes just by going there and touching there, it can make a very significant difference.
And what kind of people have you worked with in the past? What have been some of your great successes?
We've seen success in every area, and almost in every area we've seen failure. However, the successes usually are about 8 out of 10, or the improvements are 9 out of 10 that we see. There are always some that it seems to have no effect. The very worst that can happen is it has no effect, but they will come away from the session feeling good, because I tell really really bad jokes also.
So that's helpful to keep their spirits high. Really,
Yes.
not bad jokes, pretty funny jokes sometimes.
Well, and as we all know, humor can lift us out of ourselves, out of our depths of despair somewhat. And we like to be lifted out while we're working with you. And so the sessions are enjoyable. A lot of people are afraid to sign up for a session because it sounds too psychic or too scary, or it may be just too weird. No, you're just talking to an everyday guy here who doesn't know much about football, but he'll joke about it. And we'll probably just have a good time on the phone while we're working. So it's just a comfortable conversation at the least.
Okay, so you have a group that you work with on some level, and you can access anyone anywhere in the world without knowing anything more than their name?
Yeah, distance makes no difference. Distance is deceptive to us because we have to live in this world and we have to describe things many times in terms of distance. But in reality, there is no distance. In reality, there is no time. You can instantly go to a loved one, maybe in a foreign country, instantly and feel them yourself and know them. Or an example I use a lot is a mother is aware of her child, regardless of where that child is, regardless of how old the child is. The child may be a full-grown adult, and there's still a connection. Of course, the best example is the connection of two identical twins who feel each other deeply. So that tends to prove, I think, we're not looking for proof, we just do the work. But we don't care about distance and we don't care about time. We just go to the person.
I know sometimes I think that I'm about to give you the name of someone that needs some work to be done, and you just go ahead and tune right into them before I even give you a name. So is that true, that with people you don't even need to know?
I don't need names. If I tell you to go to the front door of your house, you don't need to know the name of the street you live on. You just instantly go to the front door and know what that door looks like and what the doorknob feels like. And that's the same with a person. We just go there and we see, as time is spent in sessions, the deeper the sessions, the more we see. I work with a doctor sometimes. This is a very remarkable person, both versed in medical and energy work, both, and he and I both see the same identical things. And it's very nice to go into the body and see certain areas that may be diseased or in pain or whatever, or skeletal problems, muscular aches, whatever. We usually see and feel those, and we usually can remedy those or have them in improvement. Sometimes 100% remedy. I urge you to go to the website. You'll see testimonies by people about their pain or cancer or whatever the issue. And it seems, regardless of the issue, we can influence, usually. No guarantees. Right now, I'm offering a free session to anyone that starts because there are no guarantees. And we certainly don't want them to waste their time, and I don't want to waste mine either. But I'm willing to give it a try because literally 9 out of 10 people will see an improvement, usually after a session or two. Or it may be promising enough if they have a serious illness to work on it for several weeks to have an accumulative effect of betterment, of improvement, till possibly the illness is over.
You work on pain then for some people, just helping eliminate the pain. Does that then go to the crux of the matter and help it to disappear?
Pain I have seemingly been most successful with not always again. But we're usually most effective with pain, reducing it, limiting it. And of course, pain stems from many different sources. It may be psychological, mental issues. People are in pain mentally, not physical pain. They may be in real physical pain from a broken joint, from arthritis, whatever. These types of pains usually can be alleviated, and many times they will go down and stay down for long periods or even permanently. We have examples of both.
And some of these examples are actually on your website.
They are, yeah. I urge you to hear. You'll hear recordings of people talking. There are many printed testimonials about pain, cancer, on and on, other issues. If you go to our archived website, which is featured on the front page, you will hear more testimonials about very serious illnesses that were recovered or drastically improved.
That's www.L as in Larry, D Porter, PORTER.com. And we'll have that listed at the end of the interview as well. It is a little different for a lot of people to imagine that you can affect somebody from a distance. I know a number of healers that do this, and I've seen the results. I've seen tumors disappear miraculously. When they go back to the MRIs or the Xrays, the doctors used to say, well, it must have been a mistake the first time. We must not have caught that, because they can't explain why it's gone. We see that again and again. So that's pretty convincing for those of us that have been doing this for a while, at least people that are involved with others that are doing it. It's powerful. But it is a little bit of a stretch of the imagination to go there with it. Do people often need to be convinced before you start with them, or do they just dive right in and see what happens?
Well, usually people are not convinced. They'll try a session because a professional, I have several professionals that refer me. They may be a psychologist or a chiropractor or whatever, and they have some trust in their professional, and so they give me a try. And then usually after the first session, they see there's something real about this. I recently worked with a lady with severe cancer, and the first session, she knew something real was happening. She could feel things in the body happening in that area of the cancer. And once something like that is established, then it gives us room and a foundation to go on and develop more improvements with more sessions, and we continue building. So far, we're very happy with the success we've seen with this lady.
So it does take a little faith at the beginning to dive in, but my experience has been that people that have worked with you have just been outstandingly not just successful, but happy, excited, shocked, in wonder about the work that can be done, because it's not something that you hear about very often in mainstream media. It's definitely kind of kept quiet. There are those out there that don't really want these kinds of things to be known because, well, you know, there are some industries that are built on pharmaceuticals. And it's interesting how people will have savings that they don't want to go into. And I understand that. But yet, what's more important than staying alive and staying healthy? So our experience has been pretty positive with this work. The intuition just continues to get stronger in my, from what I've seen. Do you feel like your work is increasing in the intensity and in the success of it?
It's stronger all the time. The more you do, the more you do. And that is very true of this. through the years, I've seen it increase. And I remember years ago, I would work with someone on the phone, and sometimes it was, am I really going to make a difference for this person or not? And now I just approach it. We dig in, we jump in, and we do the work, and the outcome is almost always not only positive, but successful or somewhat successful. So now it's just a matter of doing it.
Okay.
Sherry, I'm probably getting to this anyway, but I do want to point out that I don't do this work. It comes to me. I tell people, I answer the phone, and I schedule the appointment. It comes through me. We get very relaxed in the work. You're going to end up very comfortable. It's a little bit like hypnosis, but it's not. I'm not a hypnotherapist. Get very relaxed and comfortable, and things come through us. They may come through me. They may come through you. A lot of times we use a third party, some mother who's caring about her child and wants some work with her child. We can work through the mother. Or a wife caring about her husband who's in intensive care. We can work through that wife. Again, there seem to be no boundaries. It goes back to the distance idea. There's no distance, there's no boundaries, there's no single person, no single entity which houses this. There is no box, there are no parameters we fit into. I tell people, not only do we work outside the box, there is simply no box at all. There are no parameters. Anything comes, anything goes, and when we least expect it, there will be a corner turned that is beyond reality, beyond expectations, and certainly not logical, that appears. And this is what makes it so exciting.
It is. If anybody out there has been ever familiar with the Prajnaparamita, the Heart Sutra, it's similar to me, because it's like there's no this, there's no that, there's no other, there's no other. There's only what? There's only now. There's only that which is.
And we purposefully remove all thoughts, all techniques, all approaches. There are many wonderful techniques, approaches, healing modalities. Don't ignore them. Use them, please. But we don't use them. I've been exposed to a lot of them. Master of none, but that's not the point. The point is we use no intellectual construct, which might be a healing modality, might be psychological theory, whatever. We don't use these. We go to the person and we remove. First of all, we remove all thought. We try. We can't really go without thought. We want to empty the mind and go to the basic of nothingness. And once we reach nothingness, then we become something. We become something else. You cannot become something else if you're still in something else. If we're working in one strain of thought, we cannot change that strain of thought to become something else. We have to remove it. Strain of thought might be marvelous, a wonderful thing, but we don't want it. We want nothing. And then we can build with newness, new thought, new cell growth, if you will, new psychological thoughts, if you will. I'm not a psychologist. But we're building from nothing. And I can't emphasize that enough. If we rid someone of pain, usually we go to the pain. There is nothing done psychologically, physically, chemically, kinesthetically. There is nothing done. We go there and something comes through that will somehow dissipate or remove that pain, maybe by 50%, maybe 100%. Maybe 2 sessions, it will reach 100%. And this is true of most of the issues we work with. This principle of no principle.
Well, I love it because it goes right along with the meditation practice that I have and that I do with others. The whole awareness meditation, mindfulness meditation, is essentially to get us to that place of nothingness, of outside. To me, it's outside time space, because
Yes.
you can't really describe that there's anything. And in that place is everything. I think in the Ageless Wisdom, they call it isolated unity. Within the point is the whole universe.
Yes.
So that's exciting to hear you explain it so beautifully. Thank you. So you say that nothing happens, and yet we have evidence that tumors disappear, the body is healed. I know you've worked on me and the pain that was under my rib cage for about a year or more. It was gone. It came back a little bit. You worked on it a little bit more, and now it's been gone for probably 9 months. I can say conclusively that something changed drastically and that it didn't come back. People may have a little bit of a fear or worry that, oh, you can get rid of it once, but what if it just keeps coming back? What do you say to that?
Everything has a rut, a channel developed. Our thinking has channels of thought developed, the way we think. It's a rut. It repeats itself. The body repeats itself. As we know, the body has knowledge all its own, and it defines and develops ruts based on what it knows to be healthy for the body. Sometimes the ruts don't fit in with the body health. So it's up to us to gently change the flow of the body so that it's out of that rut. Sometimes the rut is so deep, we may have a few sessions and we get the body working out of the rut. The symptoms are gone. The problem is solved. And we leave it alone for a time, and sure enough, it returns. Well, the body is still slanted toward that rut, and it will go back into that rut. Now, it might be environmental, of course. You may cook and you may burn your hand, and well, the burn is eventually solved, the pain is gone and all of that. But you go back to the same stove and you stick your hand in the same fire, well, it happens again. And that's an extreme example of stupidity, but I do those kind of things. Anyway, we see ourselves go back into the same rut, a lot of times environmentally. Friends, family around us, work situations, especially stress. We all know about the stress. You return to the same stress, and lo and behold, the same symptoms come back. Well, yeah, and the guy who keeps running into the brick wall with his head, he keeps having headaches. If we get rid of the headaches and he hits the wall again, gosh, the headaches can come back. Yes, they can.
Okay, interesting, because, yeah, we talk about getting rid of our habits and our behavior patterns. You calling them ruts. I call them line of least resistance. We just easily get right back into that little place.
Yes.
I'm wondering if it's part of, I know you don't like the word belief system, but do you think that some of the people that you work with have gotten ill because they have taken on something greater than a personal issue? Is it sometimes a planetary or a family archetypical pattern from a family or past life? Or, I mean, do you see all of that, or what do you normally see when you're working with someone?
We hope I see what is relevant. There is so much to see in so many directions. But if we're working on a specific illness or problem, Usually we see things in relation to that. If they're having a pain in their left side, we're probably not going to see an airplane crash out on the West Coast. We may be influenced by, say, all the forest fires we had on the West Coast and a general atmospheric quality that influences everyone. The energetics, everyone's talking about the overall anxiety in the country today. I think we're all influenced by that. We need to be aware of these things and protect ourselves as much as possible, know that they're outside influences. We want to deal primarily, first of all, with the influences in the body. If there's a problem in the kidney, that's what we want to deal with. We may have things come to us about the person's urination. We may have things come to us about the person's not drinking enough fluids, and basically simple things like that. We also may see cellular growth that's not conducive to kidney function. We might see calcification within the kidney or some of the lines of travel. With heart function, we might see firing of the heart that is not consistent to good heart health, and try to correct that, the electrics, if you will, of the heart. So all aspects, but aspects in relation to the particular problem we're dealing with.
Do you ever see a person show up in the life, or an abusive situation? Are those parts of what you see?
Oh, yes.
And do you mention them to the person?
Usually. Sometimes it's a sensitive issue. A rape, of course, is a sensitive issue, and we may refer to it in a third-party sense, but it would make sense to that particular individual. Someone's father may show up in terms of a misalignment in the spine. Someone's mother may show up in an emotional instability, which happened 20 years ago and is coming out in some other form of illness, physical illness. So, yes, usually when I see someone, I usually see one or two people related to them. It may be a spouse, it may be a mother, father, child, whatever, who is a big part of them. I don't think we ourselves are single, isolated individuals. We are all part of others, and these others are a part of us, and that's what we see. And if we lose someone is deceased, we feel like they're still with us. Number one, they're still with our soul. They're a part of us, and I think it is wrong for us to delete them from us, so to speak, just because they're not alive in this physical world. They're still with us, and we believe they're still alive spiritually too. So some of it's balancing, some of it's an awareness that someone's father who died 5 years ago is still influencing them and wanting them, believe it or not, to have an illness so that they'll come on over to the other side and join them. I run into things like that quite a bit. And so we go to the father and say, this person needs to live a little longer. This person has grandchildren. And I argue with them sometimes.
Good for you. And do they come around?
Sometimes.
Well, I love that, because we always hear about the interconnectedness of us all and how we do influence one another. This is one of the favorite topics for the Dalai Lama to speak about, is this interconnectedness. Thank you, Larry. This has been very interesting and informative. I know we can talk a lot more. We will have additional interviews and opportunities for you to share what you do with people. I think it just takes people hearing something 6 or 7 times when it's such a new concept before they can really grasp the concept, the possibility that perhaps their pain can be taken away from somebody far away. Because I've seen it so many times and I know that it's true, it's not a stretch for me at all. I totally believe in what you do, and I've seen miraculous healing. So I do encourage everyone to go to Larry's website, ldintuitive.com. Do you have a few words in conclusion before we sign off?
Please try it. I want you to put your foot in the water. If the water isn't right for you, it's been no problem. But please try it. Especially if you're having great pain or you have an illness you think may be terminal, if there's cancer, whatever, please give this a try. It may not even cost you anything to try, and it may reveal a whole new parameter, a whole new world for you. The people that stay with me for a number of years, maybe once a month, once a week, it's an accumulative effect. Their lives continue to get better. They may have other smaller illnesses that are taken care of. So please contact us, give us a try. Thank you.
Okay, great. Thank you, Larry. I believe that the intuition, once you start to really notice your own intuition and get a sense of a feeling or a sense of somebody calling, even that simple, you know what might be wrong with someone or that something is wrong with someone when you haven't talked with them. It stretches us. It allows us to imagine something greater than what we were taught, what we were told, what we believed most of our life. As we stretch into these new areas of possibilities and perspectives, it helps us imagine. And if we are imagining our life, intending or not intending, if we begin to notice that we have a little bit of control, if there's such a thing, over our lives, we might pay a little more attention, become a little more aware, witness ourselves. What we're saying, what we're doing, so it affects the whole life, whether or not it completely takes away an illness, which it has proven to do this work, or it just stretches us. It's a wonderful thing, and we thank you so much for your work, Larry. I mean, there's thousands of people out there that literally owe their life to you, and for that, we are all very grateful. So thank you again.
Thank
and
you.
we'll close this for now.